My name is Jean-Luc Bressard, and I am the CEO of HexTransforma Healthcare, and we, the company, are the lead partner on the EWWD Project. HexTransforma Healthcare was as the lead partner, we were the organisation that effectively scoped out this project. We defined what the constituent parts of the project were, and what the objectives for the project were, and obviously as an organisation we selected and approached the various partners that have participated with us on this journey in order to ensure that we have a transnational project partnership consisting of partners from France and the United Kingdom who had the appropriate skill sets from either a research perspective or an actual business perspective to support the project objectives and the delivery of those objectives. I'm super excited about the interns. I think the internship is fundamentally one of the integral parts of this project. Our objective when we started this project was to provide an opportunity for young people who were at risk of long-term unemployment. And obviously, as an FCE, France Channel England Interreg project, we are all based in coastal towns, and coastal towns have certainly significantly higher levels of unemployment for young people from socially deprived backgrounds, especially than other metropolitan areas. So really, we were super excited to take people who did not come from a naturally, technology-based background. They didn't have parents who work at large tech firms or had done internships in tech firms. They were simply young people who wanted to work but were unable to find any work, let alone work that piqued their interest. So we're really excited, and it's been we're now 12 months into the project, and the interns, certainly the 5 interns that have joined Hex, have carried out numerous rotations, 3-month rotations across the organisation. So from finance, communications, marketing, HR, admin, data science and technology, so software engineering. And I think the resounding feedback we've had from every single one of the interns is that they are loving the experience, and we are certainly loving having them. They've been excellent. That's a really difficult question. It's like asking which one of your children you like the most. I think that I'm gonna cheat. I'm gonna say that I'm excited about the MedTech Challenge, which is our schools project, which is effectively designed to bring young people in close proximity with medical technology to again sort of pique their interest around tech and careers in tech. I'm a key advocate of making employment opportunities available for young people, just so they start to get a flavour of the sorts of jobs that are out there. And fundamentally, young people tend to gravitate towards the careers of their carers, their parents. And if you live in a small coastal town and you're from a socially deprived background, and the MedTech Challenge is really about selecting schools, 100 schools from socially deprived areas, then the likelihood is as a child in that household, you may have 1 or 2 parents who are unemployed, 1 or 2 parents who potentially are in manual labour, manual jobs, or they potentially are doing other types of employment within the education sector, etc. But it's very rare, certainly, that you will find households that are familiar or have employment in technology. So what this means for the young school children is that rather than saying my father's a plumber, and there's nothing wrong with being a plumber, we all need plumbers, rather than saying my father's a plumber, therefore that's what I know and therefore that's what I'm going to go and do, they have access via either the careers and enterprise company through their schools, or we've got STEM Ambassadors, another fantastic organization that is partnering with us to help deliver the message that actually, hey, look, there are other careers out there. Some really innovative careers working with cutting-edge technology, data science, machine learning, that you can do, right? That is open and accessible for you, whether you're a young girl or a young boy. And it's particularly encouraging the number of young girls that we are seeing working in our business. I mean, we're almost 50% male-female. So I think long may that continue to encourage young people from all backgrounds to engage in technology. Ultimately, technology is the future. This is a project that has a very clear, delineated sort of start, middle, and end point, and the project will end in April 2023. In terms of the future, our project is really broken down into 3 clear sub-projects. There is the medical device aspect sub-project, there is the internship, and then there is the MedTech Challenge. And if I try and pick off those individually, the MedTech Challenge is a transnational competition. It's like a Dragon's Den, but for school children in France and the UK. And using a fantastic engagement platform, we can allow kids from schools in France and the UK, to interact with each other, to ideate, to swap war stories of their competitions, but also to upload their content, their copy, their videos of the devices that they are looking to manufacture as part of the competition. I think the legacy of this project really is, the education of teachers about technology, the education of these pupils about technology. But hopefully some proliferation into the families and the homes of the children as well, to help educate the parents and the carers of the children about the opportunities in this sector. So I think if we do that, we will have achieved our goals, but certainly I think we would have reached and touched a significant number, possibly over 100,000 individual people. And advise them about careers in medical technology or broadly technology. The internship is I've already said, I think is one of my favorite parts of this project. At the end of the internship, we would hope that we would be able to offer full-time employment to all 5 of the interns that we currently have in our business. Right now, there's absolutely no reason, based on their performance, that we wouldn't do that. I mean, I think that probably is a given. The key point of the internship, though, is to demonstrate to other employers, whether you're a small, medium, or large-size employer, that this is possible, right? That you can take 3, 4, 5 people who have been long-term unemployed, and you can train them, and they are willing, and they want to learn, and that they are engaged, and give them that passion, that drive to succeed. And the question is, if we can do it, well, why can't other people do it, either in our sectors or in other digital sectors? Companies like ours exist. So fundamentally, I think that's critically important, that people and companies and leaders especially look at their recruitment policies and say, actually, by giving young people a chance, we're organically growing our talent, and we're nurturing our talent, and we're not simply putting a price bracket of getting someone with experience in through the front door who potentially is not from your local area. Finally, on the medical technology product, at the end of the day, this is a collaboration between multiple companies. What we aim to prove, or the hypothesis that we certainly aim to prove as a partnership, is that there is significant value in the remote monitoring of patients with lower limb musculoskeletal care disorders. So, ankle, hip, knee, joints, and also diabetes, particularly with a focus on neuropathy and Charcot. So we want to be able to demonstrate beyond any doubt that remotely monitoring these patients allows us to triage them, find out who requires care the most, but it also allows us to effectively, by collecting continuous data from multiple inertial measurement units, it allows us to effectively, look at patients and say, is that patient deteriorating in their quality of life, or their disorder is deteriorating? Are they improving? And this is critically important because obviously when we look at therapies or physio or whatever the therapy the patient is undergoing, you do want to see progressive improvement in their condition. And if you're not seeing that, perhaps it's the wrong therapy. Perhaps the patient isn't doing enough of it. We can ask those questions because ultimately what we aim to do is to improve outcomes. The final and possibly the most critical aspect of what we're trying to prove and the hypothesis we're attempting to prove in this project is the identification of postoperative complications and disorders using machine learning. And fundamentally, by building a snapshot, a digital twin of the patient all the way through the care pathway, what we are able to do is to say this is what healthy looks like from a biomedical signs perspective of a patient. This is what their gait looks like as they suffer with their disorder or disease. But as they go through their treatment, it could be that they have surgery. We monitor that patient's recovery and ask ourselves a question. Does that patient, from a pure biomedical data set, does that patient look as if they are reverting back to their preoperative norm? Or are we picking up signs that indicate that they have caught some form of postoperative infection, or potentially that they're rejecting the implant or the implant isn't working for them in one way, shape or form? So we are looking to effectively improve outcomes and create efficiency. I mean, the statistic that I love to use, and I always use, and people are probably bored of me, and certainly within our business of using it, is that the global population is 7.8 billion people, and we have 9.2 million doctors, and this problem and comorbidities, the actual pressure on healthcare systems means that this situation is not going to improve anytime soon. So the application of technology, I think, is what will help us improve outcomes and help us improve care pathways. By saying we're not going to overstretch the clinicians. We can look at data, we can let artificial intelligence take the strain, and clinicians can interject in the care pathway where they believe it is most appropriate for them to do so, and where they are notified that there is some form of interjection required. So, the data set that we will produce at the end of this project, fundamentally is, I guess, the conclusion of that aspect of the project. I think this is a great opportunity. I would certainly encourage more companies like ourselves, small, large, medium, to engage in these research type projects. It is eye-opening as to what can be achieved with the right partners and with the right levels of funding to bring about fantastic improvements, whether it's medical, environmental, and I would encourage any other small, medium-sized enterprise in the UK to actively engage with organisations that allow for this sort of research and this sort of social improvement.